the fact of the matter is you're going to have some economic issues because of it.
Yes.
So this virus is going to destroy you in different ways. In that context, even till today, this man, Dr. Tedros, continues to be in his position. He continues to be giving his opinion on how to deal with this virus. You can argue and say that it's not the right time to make him accountable. There is never a right time to make the person responsible for it accountable. I am not saying that he brought in the virus. I'm not even saying that China would have brought the virus. I'm saying there was an epidemic that was looming large, and there was a duty that was to be done by people like Dr. Tedros. They completely took the people of this world for granted by not doing their duty, and that is the reason Dr. Tedros needs to be sacked. And my appeal to the Indian government and to the Prime Minister Narendra Modi is to actually now use his power to ensure Dr. Tedros is sacked and actually start an investigation on what is his role in this.
Hello and welcome to PGurus channel. I'm your host Sri Iyer. Today I'm joined by Savio Rodrigues, and we are going to talk about the role of World Health Organization and its chief. Welcome to PGurus channel, Savio.
Namaste.
Namaskar. So, Savio, we've been looking at various things. I'm just going to set the context for you so that you can take on from there. I did some reading about this whole thing, where this virus started. COVID started in Wuhan. It was detected by middle of October, and then by the end of October or the first week of November, it was proven that it could have human-to-human transmission. And allegedly by second week of November, the WHO organization knew that this virus was capable of human-to-human transmission. Yet the world came to know of it much later. And in fact, the world came to know of it only through Taiwan, which is a small island across the Taiwan Strait from the mainland China. And it is Taiwan which alerted the world, saying that don't go by who is saying. There is a big pandemic coming up. And if you look at what has happened in Taiwan, they've got this virus completely under control. So clearly they knew what was coming and they knew how to control that. But yet, because who did not come out and say it, there is, this thing has been allowed to spread far and wide. In fact, now we are seeing in the United States, today we had 800 plus deaths, and it's still counting. We'll know the exact count only a few hours later. And this is the biggest, deaths day to day for the United States. And they are saying, even if we control it fully, we are still going to have up to 200,000 deaths. So that's a very, very big number. So this is just United States, and most of the deaths appears to be in and around the New York City area. Louisiana is coming up, Chicago is coming up, and California and Seattle are sort of a little bit under control, and I'll explain that a little bit later, but I want you to have your first say on the role of WHO and its chairman.
Sri, you made some very valuable points, and I think the world needs to know that the World Health Organization, a body that's supposed to be protecting the world and the people around the world from pandemics of this nature, is completely responsible for the spread of this pandemic in the first place. Now, whether it is done deliberately or whether it is done unintentionally is a matter of investigation that global nations must embark on and must conduct. For a very simple reason, the knowledge of the human-to-human transmission of the coronavirus or the Chinese virus is something that was known to the Director General, Dr. Tedros, and the WHO organization way back at the end of December 2019. Now, why do I say that? Because the Taiwanese health authorities had informed WHO about the human-to-human transmission possibility of the Chinese virus. Now, WHO being WHO and its closeness to China, and also Dr. Tedros' closeness to China, did not allow for them to take the matter of Taiwan's report very seriously, or Taiwan's notification very seriously. So they did not bother about it. On January 14, 2020, Dr. Tedros himself made a statement saying that the Chinese virus, in this sense, the coronavirus, there was no clear evidence of human to human transmission. That is where this entire thing goes a little haywire, because he's very categorically stated, and media has reported this very prominently, that there is no evidence for human to human transmission, clear evidence. And how has he based this opinion? He's based this opinion based on the Chinese authorities' feedback to him. Now, here's the interesting bit. You are an independent body that is supposed to investigate a situation that could lead into a pandemic based on the reports that you would do by yourself, not by the country that is supposedly where the pandemic has happened and could be responsible for creating the pandemic. When I mean creating, because by sheer lack of telling the world that this is a possibility, they have put the world in danger. So more than China, for whatever lies it's told the world, it is Dr. Tedros, as Director General of WHO, that needs to be sacked on an immediate basis and needs to be tried and arrested for absolute dereliction of duty. This is shocking, Shri. It is shocking because you see the way it's spreading. If in those 15 to 20 days, if WHO was to get really serious and not depend on what China told them, maybe this pandemic could have been controlled and kept to a certain extent within certain regions in China or wherever little it had spread. When China decided to realize that they were able to control the virus, there were almost 7 million people from Wuhan itself that traveled to different parts of the world. They were carriers of the virus. People are talking about positive cases being the issue. The positive cases is not the issue. It is the silent carriers of the virus that's going to be the biggest issue. And that is why America is suffering, because America has got a whole lot of people that would have traveled between China and the rest of the world as well. Italy, for example. Italy has been so badly hit by it simply because a lot of these Chinese that were in Wuhan or other parts of China would have traveled to Italy. And you do know about Italy and China's relationships, which are strong in the recent times. So you have who's supposed to mitigate this risk, who's supposed to investigate this health risk. It completely does not do that. It arrives at a conclusion towards the end of January, saying that there is a possibility of a pandemic. In fact, Dr. Tedros even goes to China, on January 28th, and that's when he makes this statement that China people should learn from China, that they're doing a very good job, they're being transparent, and he went on to praise China. And while Dr. Tedros continues to praise China, he keeps saying that everybody else has not been doing a great job. And so the link between Dr. Tedros and China is not a new one. It is something that has gone way back to backing him win the Director General post to WHO. And Dr. Tedros and China are very close relationship right from the time when he was the health minister of Ethiopia. So there is a connect between the nation and Dr. Tedros. And this is something that the world must investigate. This is something that the world must know. Because today, thousands of people are dying and you have thousands of people infected by the coronavirus. There is no solution in store right now. It would take us another year to maybe another year and a half to get a vaccine to treat this. You are only seeing what would be considered to be stage 2 of the virus. So you're seeing deaths which are about 30,000 plus. And you're seeing patients which are over 5 to 6 lakh plus. You are not seeing the deaths because you've not passed the stage of the deaths that could arise. The deaths in US alone could go up to as high as 2 lakh. And
it's a sobering number. It's a sobering number. And let me tell you how it played out in the United States. It's really strange how these things happen. The first incidence of coronavirus positive happened in the state of Washington, which is on the West Coast, and in and around the city of Seattle. And Seattle, it spread like wildfire, a couple of counties, and there is this iconic place called Pike's Place in Seattle. I have been there. This is like, there, it's a hangout place. It's by the pier. It's a beautiful area, and that whole thing was closed down, and that's where it kind of took root. And then it went to some people, retirement age homes, and retirement homes is where you have many people who are in their 70s and 80s, and so it just caught like wildfire. And the next state that got hit was California. And in case of California, it was not as if Californians had done anything. It was just that there were a couple of cruise ships which were stranded. They were just waiting on the sea, at sea, and they had 20, 25, 30 corona positive tested patients. And see, if you're on a cruise ship, and I have been, and this is like a, it's a big moving city, but everybody's breathing the same air, and if you're on the ocean, there's a lot of humidity. So perhaps this human to human transmission started acting up, and they were concerned, do we leave them on the ship or do we bring them ashore? And the first ship that came, I think there weren't enough tests done. So all the people were allowed to go home. Guess what? Most of the people who travel on cruise ships are retired people. Again, you had the same situation of 65, 70, 80 plus people going back to their retirement homes. And then suddenly there, it just spread like wildfire. But once California realized it, they wisened up. And I think about 10 days or 8 days before the nationwide lockdown started, California locked down. It locked down even the schools. I remember we had a public event on 8th March, and many were joking that this is perhaps the last public event, that from the next week onwards, it's going to be all shut down. And sure enough, that's what happened around 15th of March. So we are now around 16, 17 days into lockdown in California. Things appear to be slowing down, but again, it is too early to claim victory over it. But New York is certainly still on the rise. Louisiana, Chicago, and Illinois area, and I don't know what other states are going to. So New Jersey is also now beginning to show some signs of coronavirus patients, because see, most people who work in New York City, they live in New Jersey. That's just like 30, 40 miles away. You take a subway train. It's just like, think of people in suburban Mumbai coming into work to Christchurch area, not Christchurch, but the Churchgate area. And it's the same thing. People live in New Jersey and they commute to the Manhattan Island, which is the place where all the businesses are, almost all the big banks, the Wall Street, everything is over there. So, so those two states are still showing increasing numbers of coronavirus turned positive patients. Also, there was one wholesale store that used to stock all Indian groceries, and this wholesale stores had a couple of employees who have tested positive for coronavirus. And guess what? The entire chain of grocery stores in and around New Jersey area is all shut down.
Correct.
Because they don't know whether there was a transmission or not. And this is, now, here is the thing. Across the coast, it is beginning to reverberate in California also, because now what happens is, any store we enter, first thing they do is they shine this thermometer kind of thing on your forehead to see if you're running a temperature before they let you in. They clean up the cart that you're going to carry your vegetables and groceries and so on. So there is a fair amount of wariness and borderline scariness, and there are, like, everywhere there are markings. This is where you need to stand next. Don't go and crowd the guy in front of you, and so on and so forth. Hey, please don't cough. I hope you're okay.
I'm okay.
So the interesting thing that I don't know if I read it somewhere or you mentioned it. Did India also not vote for Tedros for this post?
Okay, Sri, the most unfortunate aspect of it is, while we are blaming China and we're talking about the relationship that China and Dr. Tedros had, it was also India that backed Dr. Tedros' candidature to the Director General post at WHO. There would have been reasons why they did that. There would have been strategic alliances that would have been formed because of that. But having said that, the most important aspect is today, when you look at it as an outcome of what has happened, you have to look at it in practicality. You have to look at the key points of what has happened.
Right,
But
right,
Dr.
right.
Tedros, for all his past history in Ethiopia, was not really somebody who has been known to be a very clean man.
True,
Okay,
true.
there are cases with regards to the epidemic that happened in Ethiopia itself, and how he worked towards covering it up. So I don't understand at that stage what were the compulsions that India had to support his candidate. But the fact of the matter is, how are we today? Today you have staring at a pandemic which is the whole world. You're only looking at one aspect of it. This pandemic issue that you're seeing now is related to health. It is when you cross the barrier of health and get into economics, is when you will realize that the real damage will happen at that stage, because you will hit into such a recession period that people will not be having jobs. There will be very little money available, and that's going to happen globally. While UN says China and India might not face it that bad, the fact of the matter is you're going to have some economic issues because of it. So
Yes.
this virus is going to destroy you in different ways. In that context, even till today, this man, Dr. Tedros, continues to be in his position. He continues to be giving his opinion on how to deal with this virus. You can argue and say that it's not the right time to make him accountable. There is never a right time to make the person responsible for it accountable. I am not saying that he brought in the virus. I'm not even saying that China would have brought the virus. I'm saying there was an epidemic that was looming large, and there was a duty that was to be done by people like Dr. Tedros. They completely took the people of this world for granted by not doing their duty, and that is the reason Dr. Tedros needs to be sacked. And my appeal to the Indian government and to the Prime Minister Narendra Modi is to actually now use his power to ensure Dr. Tedros is sacked, and actually start an investigation on what is his role in this.
You bring up a very interesting point. There was a press conference 3 or 4 days ago in the White House, and Anthony Fauci, who's heading up he's the director of all these kinds of epidemics and other things. He's a point man for Donald Trump. And he said that personally, he thought Dr. Tedros was a very nice doctor. However, he stopped short of saying that he may have had a role in hushing up this matter. For some reason, he didn't want to make any political comments on it, and he just stopped short of it. However, he also didn't say that he should continue. That is, Dr. Tedros should continue. So I don't know, maybe the United States also is applying pressure in this. I have no idea. I have no way to tell one way or the other. But I guess, now to each country its own, because they need to figure out how to take care of their own. And perhaps these things are being deferred for a later date. However, all said and done, looks like you are looking at least 3 months. I mean, just look at China, right? China claims that there are no new cases. But if it really started in middle of October and it went up to at least middle of March, November, December, January, February, March. So it's 5 months.
Yes.
That's how long it took from the beginning to the end. And we still don't know why 8 million cell phones got turned off in the Wuhan area. That's a huge number. Even if they say that, there could be 2 SIM cards in each phone, because these are connections that got turned off, which still means 4 million people died or unaccounted for. Let's put it that way. Let's be politically correct. Unaccounted for.
The strangest aspect of the China containment of the coronavirus, which they claim, is the fact that the virus did not spread beyond the Wuhan region.
They say that Shanghai and Beijing also had a bit of a fallout, but they also say in the same breath that they figured out that lockdown was one way to make sure that it doesn't spread. So we don't know. With China, you can never trust the numbers. You will come to know 10, 15 years later that the truth was this. So please continue.
But however, even if we go by that, The fact of the matter is the focus area of the virus has been Wuhan. But if you see the rest of the world, in particular, say India or Italy or Spain, the virus has just spread. And in India, it's not yet started because we've been being able to contain it because of the lockdown. But the fact of the matter, a place like Italy is completely destroyed. You have over 10,000 people dead.
That's true. So
In
in the
Spain,
case of Italy, just bear with me for a minute. In the case of Italy, the maximum damage has happened in the northern part, in the Milan area, where they say that the Chinese run a lot of those companies, and the Chinese may have gone home for the New Year area. There's a festival there's like an annual festival that happens, and when they came back, they may have come back with the virus. Maybe they didn't know what happened. So that is how that part of Italy got so affected so badly. And I'm sorry, please continue. I don't know how how it happened in Spain though.
well, see, the fact of the matter is you and I can continue to debate on the situation globally. But what we are staring at is probably one of the worst epidemics and pandemics to hit the world.
Yes.
Also, it's because you don't have a cure to it in the sense that the world sees a cure. Of course, there are the precautionary measures that you can take, which are the sciences that our culture has developed, but there is no foolproof methodology for you to kind of defeat this virus, because once it
Yes.
gets into you and it decides it wants to kill you, uh, it will kill you. It's as simple as that. And it's very
Right.
strange. One of the things that the people of the world need to understand is that there's in India and other parts of the world, there's this huge debate of the virus coming from a particular region or a certain religious sect, and all these kind of things responsible for spreading the virus, like it happened in the case of that meeting in Delhi. The Tablighi Jamaat.
Yeah. Yeah.
And the fact of the matter is, this virus doesn't care if you're a Hindu or Muslim or a Christian or a Dalit or a Brahmin or a Kshatriya. The virus just sees you as a human body it inhabits,
Right.
and when it chooses to destroy it destroys it. So the world needs to wake up to this truth, that at the end of the day, we can ponder and look at various other reasons for what has happened. The truth is, the developed countries, which position themselves as nations that could deal with any health related crisis, because they had cleaner hospitals, better healthcare systems, have actually proved to have nothing at all right now, because
Correct.
this virus has just come and ripped everything apart. In fact, places like Africa and India, which has not seen the spread of the virus right now, they seem to be not being affected by the virus so much as compared to the rest of the world. So Europe and certain places which are developed countries are facing far more backlash of the virus. So in the end of the day, what is important for us to understand today, and why the people of the world must understand, that this virus doesn't really care who you are, whether you're rich or poor, it's going to come after you. In fact, the rich is more likely to get affected by this virus.
Exactly, because of the circles that they move in, and people, if they are rich, they tend to travel, and
Yeah.
you don't know where they picked it up. Some people can resist it successfully, others cannot. But the transmission happens, and then
But
you have to.
one of the
Uh,
problems why the Indian government, or why India is facing the current spike in cases, is because when the virus information started to come out in the open, a lot of people were traveling to and fro
right,
globally from
right,
India.
right, right,
That is why you see Mumbai is one of the areas that has a lot of cases.
right,
Maharashtra, in
right.
particular Mumbai, in much the same way you have Kerala,
Correct.
right? These are places that people travel to and fro a lot, and internationally, right?
I'm
And that
surprised
is
Goa hasn't been affected that much. How is it in Goa?
Goa has got 5 positive cases.
I see.
The cases are not so serious as of the yesterday's report, as in it's mild.
Hmm.
Uh, Goa, maybe I might be wrong in this, but maybe the heat in Goa
Hmm.
the humidity, the extent of the heat in Goa, and because you're normally in the sun most of the time, you see,
Right, right,
you're on the beach at this time, or you're in the pool at this time, so you're exposed to the sun at this time a lot, and that apparently could be one of the reasons why it's not spreading so much. Otherwise, Goa too has a lot of tourists coming in.
right,
But again,
right,
these people are not are people again from countries that have not seen much impact of the virus, like Russia being one of them.
right,
It's not had a major impact because of the virus. You don't
right,
have a lot of Italians coming into Goa.
right.
You don't have a lot of Americans coming into Goa, but you have a lot of Russians coming into Goa. You have a lot of people from UK which come into
Right.
Goa. So that is one aspect. But by the coronavirus time, not many people were coming in.
Correct, correct. I think they usually come in for 3 to 6 months period, right? They come in like November, December, or something like
Yeah.
that, and stay for 2, 3 months at a time.
More important, I think Goa. You see, the people. It's not like a city. They anyway stay very distant from each other unless you're in a gated community. Okay, it's and either when you're outside. Again, once you're outside on the beach or you're in a restaurant, there's a whole lot of heat in Goa right now. It's the summer season, so that could be one of the factors that's really working in Goa's favor, and I think it's very good. So far that Goa has not seen that kind of spike in deaths
Right,
or
right,
in positive cases.
right. So
Not even
either
compared to Goa. Yes.
So either way, I think we have to, dig in and then ride this thing out. Maybe another 4 to 6 weeks. Who knows? For sure, it's looking like the school year is going to end before this is going to end. So I think school mostly, I guess, in all classes they'll just promote them to the next grade, maybe, and it's going to be the
Yeah.
same in the United States also. They may have some makeup classes during summer. I don't know how it's going to play out. But for sure, a lot of events have gone up in the air. Nobody knows what's going to happen. Nobody is even answering any question. No definite, predictions of how things are going to be. So I think we need to go to the crest, and you have to go above the crest and see that we are going downhill. And only then will we have some definitive dates.
The only short way, Shri, to deal
Right.
with the coronavirus, in the view of the fact that there is no medicine available for it right now,
Right.
is this period of isolation and social distancing, which still many people in India have not understood.
Right. Right.
And I think it's very important that the government, gets that message out more clearly to them, and they've been doing a good job about it, because it is only the social distancing that will really make the difference. That's how
Right.
you will not completely take control of the virus, but you will be able to contain it in some matter. But the most integral part, which India is not in a position to do, is to have tests at different levels. Okay, because India is not able to have that many tests done, you will not be able to know where the virus is or to what extent the virus is gone
Correct.
until you
Correct.
start having cases and symptoms coming to you.
Right.
The problem is, because India is so large, and because India does not have that many test kits available to it right now, they are expecting for the virus to come to them in order for them to test, which means in this context, the patient.
Correct.
Other nations like China, even the US in certain cases, are going out to hunt for the virus. That's the difference. And you have people that support the government saying that, you cannot hold the government responsible for it. I'm saying nobody is holding the government responsible for it. It is only logical that the more test kits you have, the more ability to know where the virus is and the extent of the growth is,
Right.
you will be able to do that. But if
It's-
you're not going to have testing, you're not going to know.
It's the difference between being proactive and being reactive. And here's an interesting twist, though. First, United States also aggressively started testing. Then they realized that it is better to find out the clusters and limit the testing only to those places. So today, there are only 5 or 6 areas, clustered regions. And
Right.
in the opinion of the White House and those who are advising the country, the president, they feel like Seattle area in Washington state and California, they have kind of stabilized, and we have to see how it goes. I mean, Los Angeles is actually relatively less compared to San Francisco, although it's not zero. And it's the same reason. There are lots of people traveling back and forth between China and LA, China and SFO. There are many, many flights every day. So that is the point. I mean, we have to go back and see, how much of a havoc that's going to wreak. Because, if you're in a community living, that's where things become really, really huge. However, by and large, the density of population on the West Coast is probably 1/3 or 1/4 of what it is in areas like New York City, which is why you're seeing such a big pandemic in New York City. I mean, one apartment, you'll have 1,000 people. And out here, because of the earthquake problem, we are spread out. We have huge
Correct.
cities. Yeah, you can drive for hours through LA. You can drive 2 to 3 hours easily, and you'll still be in LA. So that is the kind of size that is. So
and more importantly, Sri, your people are focusing on the patients that are being detected as positive cases.
yes,
These silent carriers, nobody is really focusing on, because the silent carriers are the ones where this virus does not affect them.
yes,
It affects the persons they come in contact with.
correct,
Right?
correct.
And that's
correct.
where the real problem will start. And that
Right.
is where the third phase of issues will start.
Yes.
So you might be able to cluster a certain area, and because of limited resources, you start testing with them. The fact of the matter is, there are so many people that have been traveling back and forth from India and the rest of the world. You're not going to be able to track everybody. So you got to hope and pray that you're able to contain it and stop the community spread, because once it hits the community level, then it's going to get very difficult to deal with.
Absolutely. And in fact, I'm just curious to know how international air travel is going to start again, because I can see that just like we go through security check, you'll have an extra line of testing where they'll have to kind of test you in 5-10 minutes to see if you test positive for the exact reason you said. Silent carrier who has not had any symptoms. However,
Yes.
he could be carrying it in their in their body, and
Yes.
those people have to be set right before they can be allowed to travel. So lots of things to solve, lots of conundrums, and all we can say, I guess, is get some sun. It's always a good thing. And if you can eat leafy vegetables that has vitamin A, that's also good. And turmeric is an excellent thing. Pepper. So these are all parts of Indian diet, and therefore I think that those are all helping in their own little small way. These are all helping, because if you look at the diet in the United States, food is typically pretty bland. Salt is added.
I think one of the reasons, Sri, if you permit me to say,
Sure.
The reason why India might not be as bad as the rest of the world at this point of time is maybe because our body has become so immune to dealing with all sorts of viruses over the years,
Right.
and some of the pathetic conditions some of the people live in,
Right.
that it might actually not have an impact on them.
True.
It's
not zero, right? It's not zero. That is the interesting point. I mean, this is not zero. There are some people who are dying out of it. So that is
no. What you do have, but if you have to look at the people who are dying. See, these are all people again who are more your developed nation kind of people. They are not really the downright poor people. Are you understanding the distinction I'm trying to make?
Absolutely. I completely understand.
The guys that are living in your poverty-stricken areas in the city, which should really make people fear about the spread of the virus. Apparently, it's not many of them happen to come from there. It is the people who have traveled.
Yes, that is true. That is
contracted. So if you're traveling on an aircraft, you are at a certain strata of society in terms of your economic hold. It is the actual poor level that Modi is trying to actually save and protect and provide some sort of impetus to them in this current situation. They are not going to be the ones really going to suffer that much, in my understanding, because they've seen so much of these viruses. India's dealt with it, and dealt with deaths of various different kinds. But maybe that could be, the sun, our ancient culture, and the fact that we have not become extremely clean an organization or a nation might save us. I mean, I know it's weird, but Could be.
Now, I'll tell you, speaking from personal experience, right? In tropical climates, viruses don't last long. So that is a given
Correct.
fact. It's across the board. Doesn't matter which virus we're talking about. Now, as to why people who are coming from abroad are carrying it depends upon a few things. For example, uh, for the first 5 years when I had left India and come to United States, right? I could, whenever I used to come back to India, I could eat, drink, wherever, whatever, anything, tap water, unboiled, boiled, nothing hurt me. But
Correct.
after that, slowly, I had to be very careful about what I started eating and what I started drinking. And today, I'm like, I have to be extremely careful what I eat and what I drink. I don't dare touch tap water. I have to boil it, sometimes even twice, and only then I sort of drink it. These are all limitations, because I know my body. If I have to stay in India for 4 weeks, I have to go through these precautions. And even after this, when I came this time in December, the first week I was sick. I was sick, meaning I was just having cold and cough and that sort of stuff. Other than that, what I'm trying to tell you is that when you are away from home, I mean away from motherland, and the longer you stay away, the more weak you become
Correct.
to the bacteria, and the bacteria hit you when you come back. So that's how you become
Correct.
vulnerable. So anyway,
Correct.
between all these things, those people who are traveling from abroad have unfortunately brought it back to India, and we have to see how quickly this is going to be contained, and how effectively it is going to be managed. And it's very, very sad to see people still going to places of worship and congregating. This is not good for you, and like you said, it's affecting all humanity. And we have to
Yes.
see, nobody has tested how it is affecting your pets in the house. Are they also vulnerable? Because that's a different dimension. You can't
Yes.
control your pet from going anywhere.
Correct.
I mean,
Correct.
if you have cats or dogs, they tend to be social. They go and mix. They go fight,
Correct.
do everything, right?
Correct.
That's another angle and dimension that needs to be explored.
Yes.
So, but
I agree.
Savio, thank you very much for joining
My
this
pleasure.
this discussion, and I hope something happens about WHO, because if they don't do anything, let's just say that nothing happens, then whatever little relevance that the United Nations organizations are having will completely melt away. Already in UN HCR, US is not a member. The moment US quits a certain group, guess what? That is almost guaranteed to just fade away.
Yes.
And if WHO also meets the same fate, who knows what's going to happen? So
Well, I can only hope that the global nations come together to ensure that Dr. Tedros is made accountable.
yes,
Because if he's not made accountable for the actions that he has committed, then you're sending out the wrong message to the world. Personally, organizations like WHO and United Nations, in my understanding, are organizations that really don't have any teeth. They act like they have the teeth to do something, but they really don't. So if India and the US get together to understand what Dr. Tedros has done and act on it, then maybe we might get some justice. But if you start with him, you will get down to the bottom of whether this was really something that has come out of nature, or something that has come out from a lab itself. We have to get to that, because that truth died with Frank Plummer, the scientist from Canada, and his death in Kenya in February. Now, people have never spoken about it, and people have not investigated it. But Frank Plummer was one of the scientists from Canada that was working on a strain of virus that he picked up at MERS from Saudi Arabia, and apparently it was a coronavirus strain on which he did a little bit of research and study, and even probably worked on enhancing his capabilities. Frank Plummer died very mysteriously in Kenya. Strangely, and which again not many people talk about, a lot of the scientists from Wuhan were working with Frank Plummer for a considerable amount of time before they left and went back to the Wuhan lab that was there. So at least about 6-7 of them were working with Frank Plummer. So this is not a conspiracy theory. This is a fact that existed. There are documents that prove that these things they were there. Whether that had anything to do with the current mutation of the coronavirus, I don't know about that. But Frank Plummer is very, very responsible to the investigation into this case, the coronavirus case, because his look into the coronavirus strain, the Wuhan scientists that were working with him, the Wuhan scientists who left and then went on to work with Wuhan again after a period of time, about 2 or 3 years. And this is something that they were doing from 2014, Shri. This strain of virus that they were testing and they were understanding was from 2014, not now.
Right.
Okay, and this is something that the world needs to investigate. That's all I could say at the end.
Yes, and there are serious questions to be answered, and I think the effects of this are going to linger for a long time, because I believe Wuhan is one of the places where a lot of pharma industry is also located in China, and therefore the world supply of pharmaceutical drugs, China was supplying a lot of low cost drugs. Those will take a beating, because everybody is going to be fearful of what's next that's coming down the pipeline. So this is like a reset button that the world has been given, and how quickly it boots back up and starts running the operating system, and then the apps on top of it, we'll have to wait and see. Thanks for watching PGurus, and subscribe to our channel.
Take care. Bye.
Bye.